Hey everyone, welcome to the Catholic Entrepreneur Podcast. I'm your host, Mitch Fisher. Today we have a unique one. I'm excited for this one. Um, Dr. Stephanie Kafie. So she founded Totally Yours Family Medicine. So I'm going to bring her on in. Hey, Dr. Stephanie, how are you?
Hi, I'm well. How are you? Thanks for having me.
Good, of course. Yes, doing well. Thank you so much for taking the time to hop on. Why don't you go ahead and start by just introducing yourself and what you do?
Sure. So, I am a Catholic wife, mother, and family physician. I have four small children. I run a natural family planning clinic online for residents of Ontario, Canada. And I also do a lot of in person work in hospitals and nursing homes, but I'm currently on maternity leave. So, the only thing I'm doing right now is raising my baby and also, of course, running my online clinic.
Congrats. That's awesome. Very cool. When did you start your clinic?
So the clinic actually started in 2020. At the time, I was on maternity leave with my second child. And of course, in Canada, we have lovely long maternity leave. So I had time to do some training for the Marquette method of natural family planning and learn about that and how to become an instructor. And one of the good things that came out of the COVID-19 pandemic was the emergence of virtual care very quickly. So this allowed me to not just serve patients in the community and in an office setting, but also online. And this allowed me to really open the doors to natural family planning where I'm located to a wide audience and really make myself very accessible. So it was a beautiful thing to come out of something that was very challenging for a lot of people.
Yeah, no, I totally agree. I think that's really cool because um, I think the education piece of NFP is so important, and so being able to do that, through content online, things like that, is has been huge. What has been the process like starting this clinic and now where you're at now? Like, walk me through that.
Sure. So, uh, in medical school, we don't do a lot of business stuff, but we all end up as independent business owners most of the time, unless you work for a large hospital corporation or something like that. So, there's a big gap in knowledge. So, I think the important part was educating myself on how to run this clinic and how to figure it out. My husband was a great help to me and still is. This is definitely a family business for us, and he does all the behind the scenes accounting and bookkeeping as well. So I'm very pleased and very happy to have that partner with me, working with me. But initially, it was just a lot of, okay, what software do I need for patient charting, for patient appointments that's secure, that's confidential? How do I meet requirements that are needed in healthcare? When I have an office, it's obviously a secure and confidential setting, but how do I offer that online? So it was a lot of finding software, finding things for something as simple as charting to keep track of all the appointments. How do patients book appointments? I'm not able to have an administrator or an office administrator keeping track of appointments or taking calls, so patients would have to book on their own. So there's a lot of software out there that was just kind of starting to come out in 2020, and now there's just a huge array of it that allows people to really have a wide range of options when it comes to clinics and healthcare in 2024 for starting their own clinic. But at the time, it was picking the right software to make that happen. And then just how do I make myself known? So initially, it was a lot of word of mouth, social media advertising, obviously on Facebook and Instagram. And then at this point, it's just consistently continuing that, maintaining a constant presence to the extent that I can, and also to a lot of word of mouth. So I was able to teach a lot of people, especially in the beginning. I dedicated a lot of time to the clinic and I was able to spread the word to a lot of people. And it continues to be spread. The Catholic world can be quite small and continues to spread through a lot of word of mouth. And I've kind of got it going to the point where it runs quite well with minimal continued new aspects. So I just continue to run the way I've been running for a few years now. Once you get the machine going, it can continue, which is wonderful. So I've been able to maintain kind of that momentum and to continue to just focus on teaching people about NFP instead of focusing on kind of the behind the scenes business aspects.
Yeah, no, that's good. So there's a virtual aspect of this and an in-person aspect, correct?
For
Um,
this clinic, actually, it's just virtual. So
okay,
I teach patients online via a group class or an individual class if they wish, and then all of the follow ups are still offered online. So everything I do for this
gotcha.
clinic is done online for NFP. The other work I offer is with patients that are generally elderly, and that is done in person, but that is not through
Okay.
this virtual clinic.
That's neat. So how you said, word of mouth was huge. How do you go about kind of promoting yourself, marketing yourself, and then what kind of I guess do you work with people across like the world, or like do you have certain locations where you have more clients?
Great question. So, the way that medical licensing is in my region, I can only work with people who are in Ontario, Canada, and that's because of my
Okay.
professional requirements. So, that's my province or the equivalent of a state in Canada. So, in my province, I work with anyone across the province. So, it's the largest population wise in Canada. So I have options that many people can access my services. Most of my services initially were covered by something called OHIP, which is our provincial health insurance plan. This allowed me to access a lot of people who were wanting to learn NFP, and I was able to teach it for free, actually, initially. So when you can offer something for free, you can imagine that you can reach a lot of people just by advertising through dioceses, through word of
Mm-hmm.
mouth, through different Facebook groups, for example. And then eventually our province changed the health insurance plan for virtual care. So I had to adapt my business to make changes. And now some of it is private pay and some of it is covered by our provincial health plan. So changing certainly along the way allowed me to adjust to where I am now. But initially, getting the word out and teaching was easier to build that base when I was able to offer something for free and not have to charge, of course.
Mm-hmm. Nice. Yeah. So what is like um your day to day look like then? Like how is it a lot of one on one virtual meetings? Is it more of the group classes? Like walk me through that a little bit.
Sure. So this for me is more of a hobby and something I do for fun. So when people ask me what do I do for fun, I say that I teach NFP. So this is something I do for more enjoyment as opposed to my main job. So this for me is basically done when my kids are sleeping. So I run this clinic in the evenings, and I answer patient questions and run my classes and follow ups in the evening. So I usually have at least a couple evenings a week that are dedicated to this. One can be formal appointments that are booked with specific set times with patients, and then another night might be a class. And other nights, different weeks might just be answering patient emails and questions. So one of the things I offer my patients is accessibility. If they have questions about natural family planning, which often many people do, everything's not textbook all the time, then I'm able to answer their questions in a timely manner by dedicating that time. So for me, it's blocking off time, especially with 4 young kids. It can be hard to manage. And this is kind of my evening work that I do to assist other couples.
Wow. That's really neat. So how do you balance that then? Any strategies for those who might be in similar positions where they're working during the day and they kind of have like their evening work or evening project or business that they're running?
Yeah, it's hard. I feel like life is always trying to find that balance, and maybe it doesn't exist. But certainly, it's been adjusting things as time went on. My husband and I will both tell you that in the beginning it was crazy. So I was so busy that I was doing this every evening, and it was very time consuming, and it was taking away from other time that I could have been spending with family or doing other work from my other clinical work. But eventually, I was able to kind of say, okay, I have to block off certain times and not do this every single day, every night for hours on end, because it's just not sustainable. So I think when you start a business, you're not really sure um, what people will take in or what the input will be, and how it will take off. But you definitely have to set aside time and set aside days for breaks, set aside days that are not dedicated to business, or blocks of time not dedicated to business, to be able to find that balance between family life and work life. For me, also, it just helps when I don't have children running around. So when they're sleeping, this is a great time for me to provide services. And a lot of who I serve are young couples. So because I'm one of them, I'm able to relate to them. And when they have a 9 p.m. meeting with me, they say, hey, this is a great time. And I say, hey, it's a great time for me. It's a great time for you. So knowing who your target audience is so
Hmm.
important, because I'm able to offer services at a time that is applicable for them as well.
Yeah, definitely. What's some of the biggest challenges in doing something like this? What's maybe the biggest like business wise challenge, and then biggest like NFP wise challenge? Like maybe go into some of the challenge with like education and yeah. I'm just curious, kind of what your experience has been.
Sure. So challenge business wise, I would say is trying to stay up to date in terms of managing our provincial health insurance versus private pay and rules around virtual care in the region I'm in. So in healthcare, there can certainly be so many regulations, and staying up to date with changes to that. There's always contract negotiations and things like that. I guess it's the equivalent in the US of insurance plans and trying to manage that. So that can be a challenge from a business aspect. And from the personal aspect of what can be a challenge from an NFP perspective, there's certainly so many different differences in women and in couples and different personal challenges that they go through. I walk with couples who are experiencing infertility. I walk with couples who have some tragic circumstances such as miscarriage and ectopic pregnancies. And those, I think, can be challenging from a emotional standpoint, but I'm able to walk with them and to assist them and counsel them as necessary, especially from a medical perspective, but also a faith-based perspective, which people really appreciate. They sometimes don't always get that perspective. So the challenge can certainly turn into something beautiful and very rewarding.
Yeah, definitely. Have you always been in Canada?
I have. So I'm born and raised in Canada, and I do live in a border town. So we're located in Niagara, which is on the border with Niagara Falls, New York.
Very nice. Okay. Um, so I'm curious, like, what's it like there, running this? Like, do you have any kind of like partnership with your diocese? I know, like, for us, I know there was, a certain NFP instructor that they would like recommend through the partnerships with the diocese. Is that one way that you kind of get plugged into potential clients? Are there other people doing similar things in your area?
Great question. Yeah, so I've reached out to all dioceses in my province to at least be listed on their website and to be a resource on their website. So that's certainly one way to reach people. I do presentations about NFP to different dioceses, to marriage prep programs. Sisters of Life is one other organization or group that I work with, and I assist them if they have women that are looking for this or couples that are looking for NFP. And another thing that I'm trying to do to reach more couples, just with general natural family planning information, is I released a book. So Totally Yours, the Natural Family Planning Handbook, is available on Amazon worldwide. So although I can only teach couples in Ontario, Canada, with this book, I'm able to provide basic information on natural family planning to a wide audience. So the book goes through why a couple would choose NFP as opposed to contraceptives from a Catholic perspective. The book goes through what are the different types of natural family planning. What is it like to actually use natural family planning? What are prayers couples can use? What are the challenges? What happens when NFP doesn't work? That sort of thing. So I found in my diocese, especially, we were just offered a bit of information at marriage prep, but not given anything in detail, and certainly nothing that was evidence-based and scientific as well. So I was able to combine both the faith-based aspects and the science and the evidence behind NFP to create a book that can be accessed by many different people. So that's available on Amazon if you're interested. And it is certainly a resource that I hope will help marriage prep programs and will help different dioceses, even though I can't personally offer NFP services to those people.
Yeah, no, that's great. I'll be sure to link that. So if you're listening, that'll be linked below the book there on Amazon. Um, what's your kind of general advice for other Catholic entrepreneurs in any space that are looking to get started with something similar to you, where you're like, yeah, I have this passion, I want to kind of do this on the side. Like, what would be your biggest piece of advice to them?
Find a mentor or two is, I think, my biggest advice. So in this space, in natural family planning, there are certainly people that I really looked up to and that I respected. So having that community was really helpful. There's a community of natural family planning instructors for the Marquette method, which I teach, that has a online forum that we all ask each other questions and talk about different situations with. And we've actually, our executive has just run this excellent business series where we've discussed the ins and outs of running an NFP business. So it's helpful to connect with other people who have done it before. And my second piece of advice would just be to have a partner to go through this with you, whether that be a business partner, that's a friend, a colleague, or someone who's also interested in this, or a husband or wife who will walk the journey with you and support you. It's really hard to do alone, and it really helps when you have someone who's cheering you on and in your corner.
Absolutely. What's how's this been like with your faith life? Like, how has this starting this venture impacted your faith life, your prayer life?
Great question. So before, I think I wanted to stay away from reproductive age couples. I focused my education on elderly couple or elderly people in general, and said, okay, I'm going to focus on elderly care of the elderly. And I felt really called after reading a book on to offer something to couples, to younger couples, and to do something more. So that came through prayer. And then after that, I really started to delve into natural family planning in terms of how can I teach this? How can I offer this, especially in my area? So I'm the first instructor of the Marquette method in the location where I'm located in Ontario, Canada. There were other methods offered, but this one wasn't offered. And I think prayer was really influential in getting me here and also carrying me through. So if you don't have that prayer life, it's hard to sustain a business in the Catholic sphere, especially when your job is to serve others, especially others who might be experiencing challenges, etc. And the other thing is, it's made my faith more public. So if you would have told me 5 years ago that I would have written a Catholic handbook on natural family planning and been telling people about this on the internet and everywhere else and advertising about it, I would have said, "Oh, you're crazy. I would just want to put my head down and work in my hospital room or in the office, and that would be it." But no, I've been called to do something else. I've been called to evangelize. I've been called to be much more public, much more open, have a wider audience. And God has given me the grace every step of the way with the inspiration of the Holy Spirit. So that's certainly come through prayer. And it's certainly been a journey walking to that point to be, okay, be not afraid, walk forward, and God will give you the grace to do what you need to do.
Yeah, that's beautiful. That's something I've been reflecting on lately too. Just like that idea of putting yourself out there. Uh, if you're called to it, was that difficult? Like obviously you said something you didn't see yourself doing. Was that challenging?
Yeah, it's absolutely challenging. There's a fear aspect of what'll people think, what can I do professionally and personally, and how can I make this work to make sure that I'm able to serve the population that needs this and anyone else who's interested. I do serve people from all faiths, so I have people from all different faith backgrounds come and want to learn natural family planning with me, and I welcome them. But it's certainly, how will I do this in a way that is appropriate and that'll serve God and serve others. And that's been a beautiful challenge that I've been able to work through. And I think the end product is something that I could have never done without myself and without God's grace.
Yeah, definitely. That's beautiful testimony. I think sometimes that's the biggest challenge for people who have a skill or something that they feel they need to pursue. It's just like that aspect of putting yourself out there. It's a hard hurdle to jump, but if the Lord calls you to it, so many beautiful things happen. Um, I was gonna ask, do when people come to you, by the time they get to you, are they already like sold on NFP, or do you ever get people who um, aren't so sure about it, and there's like that education piece about it?
Yeah, good question. So I offer something called a Teach Me About NFP appointment. It's free, and it's before people come to me to book a class. They can come and just talk about, what is it? What do you offer? And sometimes I have spouses and couples that come to me where one person's sold and they've been through all the theology of the body training. They've been through all this ministry and they're like, yep, this is what we got to do. This is what the church says we got to do it. And the spouse is like, I don't know. This is kind of not what I know about. I'm not convinced. And then I'm there to provide that education, provide that information, and need to provide them with reputable sources, etc. So it's been a bit of both, of couples coming to me saying, hey, we want to do this, we're set, and other couples being like, hey, we're not so sure, can you educate us? And I think that was one of the reasons I wrote a book too, was because I was getting asked the same questions, and I was like, wow, this means there's a gap. People don't really know all this, what we would consider maybe basic NFP information, but it's not being offered, whether it be at marriage prep or at their university campuses, or maybe they haven't been able to seek it out and haven't had those resources. So I wanted to put all those resources in one place for couples to access. So I say one of the people that I wrote this book for is the reluctant spouse. So if there's someone that's kind of reluctant and says, oh, I don't really know, you've got your evidence, you've got your question and answers, you've got everything kind of laid out in a very straightforward way. But from a business perspective, I do offer that Teach Me About NFP free appointment to kind of give people an overview of what I offer and to say, hey, what are your questions? Let me address them before they invest. And when you're offering a one-on-one service like this, I think it's really important to give some sort of consultation that's free, or to give an introductory session. I think it helps people get to know you. It shows that it's not just a program that you click that says, send me the link, and then spend all this money on this program that you might never use. And it shows, hey, this is who I am. This is what I can offer you, and you're welcome to choose it or not. But here are the advantages, the disadvantages, and it helps people in their decision making. And I'm very open about that, especially with all different types of natural family planning methods. I only offer one at this time, but I have been educated in other ones as well and learned other ones myself. So I'm able to offer some advantages and disadvantages of other ones and have that open and honest discussion with couples, which I really appreciate.
Definitely. Where can people find you, keep up with your work, and kind of what you're doing?
Yeah, so the best place would be on Instagram. You can follow at Totally Yours Family Medicine. We're also on Facebook at Totally Yours Family Medicine as well. And then my website can be linked as well below at totallyyoursfamilymedicine.com.
Awesome. Okay. I'm going to make sure to put that below too. So if you're listening and want to check out Totally Yours, definitely encourage you to do so. Dr. Stephanie Kafie, any last words?
God bless you on your journey. May God give you the grace you need to pursue your vocations and your businesses. And thank you so much for having me. I really appreciate it.
Awesome. Thank you so much for taking the time. And thank you for your ministry and what you do. And yes, God bless you on your journey as well.
Thank you. Take care.
Bye.